At this point, it is certain that you have already learned the definition of nursing research, and what could be the different purposes of doing it, as well as the reason for doing it in the clinical practice, education, and other areas of nursing practice. At this point, we are to discuss the research process. The research process is composed of 5 phases and steps. There are the conceptual phase, the design and planning phase, empirical phase, analytic phase, and lastly, the dissemination phase. Let us talk about them one by one. The first phase in nursing research process is the conceptual phase. It is known to be the intellectual process. The researcher spends time thinking and reading about the clinical problem of interest, and he or she should be able to articulate a significant problem of concern to the clinicians and other colleagues. It is when the researcher starts formulating clinical problem, reviewing the literature, and determining the research purpose. It includes, for the step one, the formulating and delimiting of the problem. When we do say delimiting, you are trimming down the subject matter to smaller ones that could be researchable. Second is to review the related literatures. It could be done through the use of search engines in the libraries, both online and physical libraries. Undertaking clinical and field work, defining the framework, and developing conceptual definitions. And of course, you start formulating your hypothesis. Second would be the design and planning phase. It is said by an anonymous author that if you fail to plan, you will plan to fail. This phase of the nursing research process is when the researcher makes decision about the methods to be used, the research design, the possible respondents and participants, data collection, and analysis. Methodological decisions have implications for the overall quality of the study. Others may include selecting the research design, developing protocols for the intervention, the step by step, identifying the population to be studied or your sample, designing the sample plan, specifying methods to measure variables, developing methods to protect the human rights, taking note of the patient's bill of rights, and of course, the ethics in nursing research. And lastly, finalizing and reviewing the research plan. The third phase would be the empirical phase. It includes collection of the data, preparing data for analysis. The same data collection procedure is implemented with all the study participants, and procedures are in place to prevent missing data. There should be attention to detail that is being executed by the researcher. It is technically when the researcher starts to prepare data for analysis. And of course, the fourth is analytic phase. It is when the researcher starts to analyze the data and interpret the result. Interpreting the result should include the relation or its relation to the previous study conducted, which were gathered during the review of the related literatures. Lastly is the dissemination phase. It involves communicating your research findings to appropriate audience. The results of any research study are of limited use unless it is communicated to appropriate audience. For example, a research in nursing should be discussed or be shared onto the nurses who are in the clinical areas, possibly in the healthcare facilities like hospitals and medical centers. Also in the communities, but may include also in nursing education and other fields of nursing. In that case, those nurses in the clinical practice would be able to utilize research evidences that is included in the nursing research evidence-based practice. Take note also that there are many different ways onto disseminating nursing research. It could be in a public forum wherein the researcher stands as the speaker and sharing the results and findings of the research. It could be published in a refereed journal. And of course, it could be presented in online uh, methods. Let us review again the phases of the nursing research process. Remember that there are 5 phases of the process. Just remember C, dead. It is first the conceptual phase, the design and planning phase, the empirical phase, the analytic phase, and lastly, the dissemination phase. Alternative routes to problem solving. There are many ways on how, as an individual or human, correct or solve their problems. So the following are the different approaches that we may be or have been doing since before. It is presented in a ladder form, for it represents that when you see or check onto the last or bottom of the ladder, it is the lowest form of solving the problem. And the highest form would be, of course, the one you can see at the top of the ladder. Look at the bottom part of the ladder, which involves ignoring or redefining the problem. So, if, for example, when you experience a concern or a problem in the clinical area, is it worth solving or should it um, affect the outcome of your nursing interventions of and or the patients? Or for example, you've experienced a concern in the household. There are times that we do ignore the problem and later on it will resolve on its own. So secondly, we utilize the faith or we leave it to the Lord, or some says bahala na si Batman when when solving their problems. Sometimes the solution that are coming from our mind are uh, effect of habits and traditional practices. Thirdly, would be the authority. So some people come from, or it comes from other people's expertise. So next would be human experiences. Your problem solving skills may be affected by previous or past experiences. Trial and error, of course. You may be trying to solve problems, and when you fail, you try to solve it again. Next would be logical reasoning, which combines intellectual faculties and formal system of thought. Of course, we utilize our common sense when we do solve the problems. Next to the highest would be problem solving and the nursing process. So lastly would be solving the problem utilizing a methodological step-by-step process such as research. So it is a disciplined research where the most of the practices are sophisticated, which includes methods of acquiring knowledge.